So we did an investigation into the US FDA adverse reporting system database with more than 3 million reports from healthcare professionals from 2013 to 2022. And we highlighted the associations between 212 marketed anti-cancer drugs in the US and skin adverse events. Targeted therapies were most frequently associated with skin adverse events, followed by chemotherapies. And treatments like mechloretamine, methotrexate, and vemurafenib were particularly prominent in their associations with various skin adverse events. So, although these data do not allow the assessment of skin adverse events incidence with anti-cancer drugs, as they are likely underreported, our method could enable quick identification of signals of skin toxicity after the introduction of a new treatment. So we also present another survey that was conducted in China among 2,244 cancer patients treated mainly with surgery for 85% of them and chemotherapy for 76%. And we've revealed that the overall prevalence of cutaneous adverse reactions, excluding hair loss, was 26%. Pruritus, xerosis, and pigmentation were the most common symptoms of cutaneous adverse reactions of cancer patients. And patients with cutaneous adverse reactions were more likely to experience emotional distress, sleep disorders, and a decreased quality of life compared to those without skin adverse events. So dermocosmetics can play a significant role in the management of skin adverse events induced by cancer drugs. Skin toxicity management strategies should always start with implementation of preventative skincare regimens at the beginning of cancer therapy, including broad-spectrum photoprotection, skin hydration, and non-basic, no-true cleansers with a pH close to 5. Dermatologists and oncologists need to be particularly attentive of the occurrence of skin toxicities in cancer patients, especially with the new drugs approved for cancer treatments, as this field is evolving very quickly. It's important also to educate both the patients and all caregivers about these side effects and ways to prevent and manage them. Some are very specific of some oncology treatment classes. And these side effects can not only deteriorate the skin, but also considerably impact patients' psychological and overall health. So, I would start by educating the patients and caregivers toward potential side effects induced by the treatments protocols. Monitoring skin adverse events is also crucial when patients are exposed to anti-cancer treatments, especially given the broad associations between various drugs and skin-related side effects. Then prevention is key. Skincare, including a gentle cleanser with a pH close to 5, moisturizer, and photoprotection should start as soon as possible with the cancer treatment. In cases of drugs leading to hand-foot syndrome, urea-based emollients could also be recommended. Last, it's very important to monitor the side effects and have a specific management depending on their severity. For this, we have developed recommendations together with dermatologists, oncologists, radiation therapists, and oncology nurses regarding the side effects induced by chemotherapy, targeted therapy, immunotherapy, or radiation therapy. So first, it's very important to continue to monitor the skin side effects of the new drugs approved each year for the treatment of cancer. Second, it's also important to continue to prove the efficacy and the safety of our dermocosmetic products in such a fragile population. It would be even very interesting to include a skincare kit whenever an oncology drug is tested in clinical trials, as a recent publication showed that in the phase 3 trials of 98 drugs, FDA approved, 60% of patients stopped the treatment due to a rash. We continue to run clinical studies around the world as the protocols may differ, and we need also more data on diverse populations.